Hi, everybody. I'm Keilah Pomeroy, licensed independent clinical social worker, and I have a guest with me today, Josh Cutler, also a licensed clinical social worker.
Good morning, Keilah.
Good morning.
Yeah.
We are here talking about, on today's episode, how to navigate the mental health system to find a provider. So yeah, you might be asking yourself, I'm really stressed out with life, and how do I get some support? And the yoga class and the deep breathing meditation are helpful, but you want something a little bit more hands-on with some feedback, kind of interacting with a professional in the sort of behavioral health space. So how do you find somebody? Like, a lot of people kind of just stop there because it's a bit of a mess. So I've got Josh here who is going to show us some tips and tricks of how to find a good mental health provider that can kind of support us through our life process, and some just kind of common ways just to kind of start of things that you might try that might work but sometimes take a lot of effort on your end, which is super easy to do when you're feeling depressed and getting out of bed is a challenge. um, it just makes a lot of sense that you want to spend hours on the internet looking for a provider that you're going to bare your soul to. So Josh is here to show us the way.
Well, thanks, Keilah.
Yeah.
And anyone that has interacted with the mental health system, either as a professional or personally, has had the experience that it's very difficult to navigate. And a passion of mine and of the work that we're doing in our system is to make it easier for people to navigate the mental health system. Certainly, the road to recovery is a long and winding one that may not necessarily be solved or lead to healing with the first person that you see, but it's going to be a lot harder if you find yourself just hitting your head against the wall about what resources are available and aren't. So we wanted to spend a little time this morning just talking through some of the basic ways, some paths to go down that may or may not lead to the perfect resource for you, but hopefully give you some direction on where to go, and also spend a little time talking at the end about a program where you would actually have access to me and Keilah for both counseling and care navigation. So you would have some personalized support as part of your benefits through the health system that you work for. So I'm going to share my screen here. I've got some things open, and let's see. Does that open up? Can you see that?
Yes. Yeah.
All right. So often the first thing people are going to do when they're looking for a therapist is go to our trusty friend Google. And just to back up, people may also ask friends and family, certainly if you have some connections with the healthcare space or you know anybody in healthcare, you may talk to them. And they may be really helpful and give you some pointers. But often people go to Google. Someone might love their therapist that they're seeing, and they say, "Oh yeah, they're great." And then you call them, and they're totally full, or they don't get back to you, which is not uncommon if someone's a really good provider and has a great experience. So certainly you can Google. This is not where I would start. I'm just starting with where most people start. Um, so here's a number. We're in the Seattle area, so I'm looking specifically at Seattle resources, but I imagine Google will work wherever you are. And so here's a number of sites. And so one in particular that I often look at is called Psychology Today. So they have a magazine, but they also, it's basically like a Yellow Pages for therapists. So they'll do listings. So I'll write here is my zip code. So these are a group of therapists that are available in this area. If you are on the Providence health plan, your card may say Blue Cross or Blue Shield on it, but that's not actually the insurance that is available to you for mental health benefits. It's actually Optum or United Behavioral Health is sort of interchangeable, the name for that, but that's the carve out that our insurance plan uses. So you would want to go to Optum here. So these people have said that they all are in network with that and they're in this area. So this gives you a more specific search. And you can look at their websites, and there should be some good information there. Another great resource is our EAP. So if you go to liveandworkwell.com, this is where you can get access to our caregiver assistance program. So if you go here and then you type in choose well and click enter anonymously, this is where you get access to our specific caregiver assistance program. And you can either search here for providers, or you can call this 1-844-875-5716 number, and you will speak with actually a licensed counselor right there, who's going to just do a quick assessment and then get you connected to some resources. Usually they'll give you a list of 5 to 10 names and authorize some care. So we actually get 10 visits at no charge on our caregiver assistance program. It's a great benefit. Sometimes I hear people call those folks and aren't able to always get an appointment, but if you call caregiver assistance back, they're supposed to assist you with that. The next good place to look is your health plan website. And if you're on the Providence health plan, which if you're a provider or employee within the Providence or Swedish system, you likely are. And actually, one good place I like to look is here. If you go to find a provider, and I'm gonna just, you can browse by provider networks, and we're here at Swedish in Seattle, so I'm gonna look there, but you can see there's lots of other networks here, and I'm gonna look in the same zip code. And here, again, if we go to find a service, we go to mental health, you can see there's all kinds of facilities. And then if I go back to providers, find a care provider here, and you go to mental health. And I'm just going to go to counseling for adults. Here it comes up with, these are all the providers in your network that are within, how many 5 miles of the zip code. So I'm actually going to search there. So, and this, again, you would be able to see who's in your area. You could always, most of these people will have websites, you can call them. But sometimes the experience people have is they call a number of providers and people just aren't taking new patients. And that's, that can be challenging. And one
How
other
often do
resource,
you,
oh, go ahead.
I'm sorry to interrupt, but how often do
Yeah.
you find that these, because it says accepting new patients with that green dot, how often do you find that that's up to date?
It can be not always accurate. I mean, it should be up to date with what people are reporting to the health plan, but with behavioral health, and I've experienced this as a therapist with people on my calendar, one week I might have a few openings and then I get a bunch of calls, and then suddenly I'm full for the next few weeks, and I don't necessarily always reach out to the health plan every week. They're usually sort of checking, in every year with, are people generally taking new patients? But as a therapist, you only have so many spots in your schedule. So you may generally be, but the next few weeks are pretty full. So it's good to just check directly with them. And then here's 211.org. In Seattle, this links to the crisis clinic and some other resources, but no matter where you are in the country, this actually is a great place to look for resources for yourself or a family member. So do you have any just general thoughts on your experience helping people navigate the system before we get into our specific program, Keilah?
Yeah, it's a certain sort of complication. I mean, it's not like difficult necessarily when we think about like um, something super challenging, but when it's presented in the context of, suffering from depression or anxiety, or you're already like burning the candle at both ends and you just worked a 12-hour shift and you've got children at home, and this takes a little bit of concentrated time to really kind of float through everything, and then kind of how much you're like investing in the process too, and how important it is to find like that perfect unicorn fit. Sometimes it's pretty easy just to find anybody, but that feels, from my experience of looking for a therapist myself, that feels kind of like not worth it if I just am finding like anybody.
Mm-hmm.
And because you do want somebody that you feel comfortable talking to, because they're going to see you in a way that no one else sees you, and you're not vulnerable in that way with pretty much anybody else in the world.
Yeah.
And so, yeah, like it kind of gets like built up in your head a little bit of like, it's got to be the right person. And I
Mhm.
don't know if that's necessarily true. I think finding just anyone is still better than nobody. Um, but
Yeah.
I don't
Yeah. And when we're talking about just anyone, these are skilled professionals who have gone to graduate school, who have gone through the experience of getting licensure, and sometimes we also can in the days of online dating and profiles of, and I hear this from friends that they look through all these profiles for all these therapists, and it becomes more about how good their website is and how much you like their picture, which is
know.
not always, in my experience, reflective of what it's like to be in the room with somebody.
Hmm.
And
Hmm.
so it may be that you're like, well, I'm not sure about this person. I don't love their website. It was kind of not a great picture, but they've got some training, and they say they treat depression, and they're in my health plan. Maybe this is somebody that I'll give a chance to. And I've certainly had the experience, personally, of going to therapy where I wasn't quite so sure about the person I was seeing, and then they ended up being really great and just the person for me. And I've also, as a therapist, especially like in primary care, when I was working as a counselor in a clinic, where I would get pulled in for people with, all kinds of things going on, and they didn't really have a chance to pick me. Their doctor just said, "Josh is here. You should talk to him."
Hmm.
And had the experience of people even coming back the next time and saying, "I really wasn't so sure when you came in the room if you would be helpful, but now that we talked and I really got a sense that you cared for me and knew the issues that I had going on, I really appreciate that I have you to talk to." So sometimes I would say I want people to get in with the person that feels right for them, that they're really comfortable with, especially at a time when they're feeling really vulnerable. But sometimes also people can, think that they have to meet this perfect person. And our media, the media certainly plays this out. There's a wonderful video on YouTube by Kristen Bell. Her therapist goes on vacation. It's like homage to how amazing she is. Google that. But it just sometimes can also, I think, build this up to, I have to find this perfect, amazing person versus I need a skilled professional who's going to be able to help me with these issues. Certainly rapport is really important. And if you sit down with somebody and you just are not feeling any connection, then, and you aren't feeling like the therapeutic approach that they're using is going to be helpful to you, the research also shows that then it's probably not a very good um, therapeutic relationship, then it's not going to be very beneficial. But if after a little while it feels like, yeah, I could work with this person, and they seem to be really empathetic and understand what I'm going through, and some of the interventions they're offering, I think they'll be helpful, it's worth giving that a shot.
Yeah, totally. And I think you brought up a really good point at the beginning of that is just that the people that you're looking through have already met the minimum standard, right? They're already licensed. They've got a necessary 3 years of experience before they can even get licensed post graduate work. So they're they're all qualified. It's just a matter of rightness of fit. And
Mhm.
there's no way to really know that unless you just like jump in and try it. And even if it's not like a rightness of fit, but it can still be helpful while you look for, a better fit, or while you grow and change and develop, and it
Mhm.
becomes a really good fit because you've built that trust and rapport.
Yeah.
And it's just kind of jumping in and doing it and seeing how it goes, and like giving yourself permission to make a mistake or
Mhm.
to choose somebody that isn't going to pan out, because I think people
Mhm.
put a lot of pressure on themselves to find somebody that they can like build this long-term therapeutic relationship with.
Mhm.
And it's just like the dating world. I think romanticism has really messed up love, and I think romanticism has also messed up getting a therapist.
Yeah, I agree. And also, depending on the type of therapy you're doing, it may not be that, I think there's a lot in our culture just around, like Freud and Jung, like loom large, that I'm going to have to lay back on a couch and, detail every part of my difficult childhood. And that certainly comes up. And if it's relevant, it's something we talk about. But, um, as a cognitive behavioral therapist, a lot of what we're focusing on is um, helping you to develop skills to be able to engage more meaningfully in your life and not get so hung up on some of the difficult thoughts and feelings and symptoms that are causing issues. And so it's more focused on the here and now. And if you're triggered by the past, certainly getting into that. But sometimes there's this misconception that I'm just going to spend all this time rehashing difficult, painful things, and that's not necessarily the business that therapists are in. Some people, that's going to be more of an approach that they're going to take, but at the end of the day, the goal should always be how to help you to have a better life in the here and now and have more meaningful work and relationships and everything else moving forward, and not be so hung up on the past.
Hmm. Yeah, yeah. Um, so one of the things that we kind of provide is that support in finding that therapist or finding a therapist to help you through the particular situation that you're in, if it's not necessarily a long-term plan, but more a situationally based support. Um, and rather than being super depressed, eating a box of crackers and going through all those internet sort of sites, you can just pick up the phone and call the patient engagement center, and they can link you up to an appointment with us. And so we can help you navigate the system, make it a little bit more fun to navigate the system, and we can also provide interventions within that encounter so that you're getting help right then. It's not like, oh, talk to us and continue to wait to get some
Yeah.
like actually like practical or pragmatic interventions in place. Um, you can start right away with us and then pick up with whoever you find as a therapist, and we can collaborate in that process together, because it
Yeah.
does kind of suck to try to find somebody, and
Right.
it's when you're already feeling pretty crummy.
Yeah. So this is the service that Keilah and I work in. That's part of the Providence St. Joseph Health telehealth system, and this is we are providers for Swedish, but we're opening this up to the broader system starting in Washington State. And so this is basically, you can get same day or next day access to a skilled mental health professional, so including one of us. And so you can call this number. The acronym is actually 833 PBH well. So write that down, 833 PBH well, and have the ability to get a same day or next day, or really when works for you, appointment between 7 a.m. and 8 p.m. every day of the week. And you'd be able to have a meeting with one of our team, and we start by providing a comprehensive assessment where we really talk through your situation with you, get some key information about your life so we really understand kind of the context of your situation. And then we'll, again, make some recommendations right there of things that you can do. Actually, we do provide ongoing counseling, not necessarily weekly for years, but on through the caregiver assistance program benefit, people can get up to 10 visits with us, which is pretty great. And actually, we find that a lot of people, if they're able to get help quickly without waiting weeks and weeks and having things get worse after some visits with us, actually start to feel a bit better and don't necessarily need to go get connected to additional resources. So we want to start with offering you skilled mental health support right out the gate. And then if you are feeling like, well, I really want to get connected to somebody in person, we can help you navigate that system a bit. Um, won't necessarily always be able to find you the perfect unicorn therapist that's available and in your network, but we'd be able to help you provide some skilled navigation to be able to go through some of these lists together and really help you identify what is really the right need for you, and clarify what the specific issues you are dealing with, because sometimes people have a lot of anxiety, but aren't necessarily recognizing, oh, there's some trauma connected to this, or maybe there's an eating disorder that's a concern, or maybe it's depression is a bigger issue, or um, you're drinking a lot to manage your depression, and we can help you sort out, well, would it be better to focus on the depression right away, or get you right into some treatment for alcohol issues. So that's where it can be really helpful to talk with a skilled professional, not just about how to get connected to help, but figuring out what exactly the help is that you need, because there are also not just therapists, there's higher levels of care, including partial hospitalization or intensive inpatient or outpatient for addiction. And so there's a number of different kinds of resources that might be available to you that you didn't even know to look for that we can help you with.
Yeah, that sounds good. All right. Anything else that we want to add to this particular episode, I guess?
I don't think so. I think we covered a lot of ground. I really
Yeah.
appreciate people taking the time to talk with us about this important issue, and I really hope that you'll give us a call. We would be happy to give you a personalized version of this and talk with you about what specifically would help you to get your life going in a better direction if you're struggling.
Yep, sounds good. Thank you, Josh. I appreciate your play-by-play.
Thank you, Keilah.
Yeah. All right. See ya.
Bye.